This is Dr. Kelly Cunningham. We've had a chance to visit about some of the non-surgical and surgical applications of orthobiologics, which is our new project dealing with cartilage and soft tissue injuries in orthopedic surgery. Now we want to talk about some of the exciting future trends that are out there, and these involve manipulation of donor and your own cells to not only enhance and restore function and athletic activity, but the real holy grail of orthobiologics is to regenerate tissue. And we think some of these have the potential to do that. First and foremost, platelet-rich plasma has been used to great effect in Europe and now the United States for over a decade. And some of the scientists now are beginning to manipulate the different growth factors. Often there are 8 to 10 to 12 of these in your own serum, and pull out the ones that are specific for cartilage or soft tissue injuries. That will greatly enhance and magnify the effect of the healing that we can get from these factors. Another trend that's very exciting is the use of juvenile cartilage grafts. Donor selected grafts from young and teenage patients have 10 times the growth rate in the surgical and non-surgical setting that adult cartilage cells do. And we find that this has great potential, and there are now clinical applications for injection of donor juvenile cartilage. Finally, stem cell manipulation will literally change year to year, as it is the area of the most exciting research and development. Right now we use your own stem cells, generally drawn from the bone marrow, and that can be an uncomfortable and somewhat inconvenient process. At some point in the future, we think we'll be able to pull stem cells from the lining of the joint during surgery or injection, and even from fat cells in the surrounding area to manipulate these cells into cartilage cells. And that will make this an easier and more widespread technique. Embryonic stem cells taken either from the placental tissue or from amniotic fluid also have great potential for what we call pluripotent stem cells, cells that can immediately grow with minimal manipulation into cartilage cells. These need to be studied a bit more before they're clinically applicable, but we think these hold great progress, great potential for the future. I would encourage you to go to the website and look at the in-depth studies and outcomes that will be published in the literature and followed on this website over the coming months and years, and follow some of these exciting breakthroughs in orthobiologics.